The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. So excited to have our guest back on the show today, two-time guest. Hopefully, we do everything right and we make it a three-time guest. Here to share with our audience is Dr. Jeffrey Scheperle. Say hello.
Hi, everybody. It's good to be back.
Yeah, it's great to be back. Website is jeffreysscheperle.com. We'll make sure that we've got that spelled out on the website and on Facebook. Thanks for being here again. Dr. Scheperle, I know you've had a couple of practices. You've got a great amount of experience there. You're helping other dentists. Tell me one of the reasons that made you decide from going, when you hung up the clinic and you decided to start working with other dentists. What made you do that? What made you decide to do that?
It's kind of multiple reasons. One is a small reason, and I think a lot of dentists run into this and don't really think it's going to happen to them. I messed up my back a dozen years ago, and that kind of changed the way I practice. I brought in associates and so on to help lift the weight of the work for me. And so I foresee that I can do consulting work, advisory, mentoring work much longer than I can do physical dentistry. Another thing is, I actually like change. So it's a change and a challenge. And so I wanted to start something on my own from ground up and jump in and do it and see what I can do with that, make a difference with a different mode than chairside. So it's, I like the, I'm already thinking about starting another business. I haven't decided what yet, but it's already on my mind.
Awesome. So, something that I talked about with a guest here on the program about a week ago, I'm going to bring it up again, just so someone else hears it. This episode, the NBA playoffs, since they last about 11 months, should still be going on. By the time this airs, I think they go till middle of June. Michael Jordan always had a coach, always. And as great as he was, I don't think he's the best player ever, but he's definitely in the top 5. As great as he was in his peak, you would see him in timeouts and he's listening to a coach. He's absolutely 100% listening to a coach, the greatest in the world. So a lot of dentists out there, a lot of business owners in general think, oh, I don't need a coach. I've got this. What are they going to do that I don't know, etc. Tell me, what's one of the top reasons or top couple of reasons why everyone wanting to achieve greatness should have a coach?
Well, here's a really simple example. And it's not quite a coaching territory, but it resonates with that. When you write something, you write a letter, you proofread it. You read, you skip over your same mistakes when you proof your own work. That's why we have spell check, we have grammar assistance, we have AI now, or you have your friend or coworker that is good with those things to review, to find things that you overlook. A coach is doing the same things. They're finding things that you may overlook, or in a negative or a positive way. They might say, hey, I've observed that you do a really great job with A, B, C situation, and you don't know that you're good at it. So they say, hey, let's work on that and build on that. That might be your gold mine of a resource. Another thing that stuck in my mind is all the way back to when I was like 12, 13, 14 years old, playing basketball. I was always one of the tall kids, so they liked me on the basketball team. And there was a couple of people that were taking pictures, and then they started showing us players, here's what you looked like when you did this. So it was a photo documentation of, here's how you looked when you're doing a layup or when you're shooting your free throws. And so it was, you got to look at yourself and they go, if you did this instead of that, you would probably do better with it. So there's athletic coaching, there's business coaching, there's life coaching.
Right.
Everyone needs an outside perspective, and it's an accountability thing. So
huge.
Accountability is huge.
Yeah.
It's easy to, we've all tried to adjust our diet or adjust our exercise, and we fall short. And if you don't have anyone engaged in it with you, it didn't happen, if you want to go that route. So
Yeah.
accountability coaching is a phenomenal way to really bring out your best and keep you moving forward and keep you attached to your goal. If you look at Tony Robbins, some people like him, some don't, whatever. On Instagram, I think it is, his ads pop up for me all the time. And one of the things he runs routinely is just a photo of himself and it says, get a coach.
Yeah.
It works.
Yeah. I bet you money that, bet you whatever you want to bet, Tony Robbins himself has a coach. Hey, let's talk about coaching a little bit and problems and challenges that you're seeing right now. What are some of these problems and challenges that you see dentists facing, between even maybe something new that is new since the last time you and I visited?
Actually, I was at the Thrive Live event by Henry Schein in Las Vegas last weekend. And I was talking to a dentist who's been practicing for, I believe, 15 or so years. And he was getting a little resistance from a staff member. He wanted more cross training. He had I don't know, I don't remember exactly, perhaps 8 or 10 employees. And one person was in charge of all the insurance and the money portion of things. And he wanted someone else cross trained, and they kept giving a little bit of resistance to it. Like, oh yeah, I'll get to it. I'm getting to it. I almost got to it. We got busy, lots of excuses. So he started running reports and then said, oh, let's have a meeting tomorrow, run these reports, and we'll discuss to make sure everything's going well. The reports the employee ran were drastically different than the reports he ran. And it wasn't a competency thing. The employee, to make it their job, to make themselves look better, they were deleting. If a patient was not paying, they deleted the treatment plan and tried to basically erase it from the records so that it looked like the aged balance was the age balance report looked better, but it was fake. So cross training, old school thing that people maybe don't talk about as much. Have people cross train. As a newer doctor, go ahead and take a practice management CE course, or call whoever your practice management software company is, call them, ask for some training so that you can do some spot checking and find errors. I found errors. I don't think it was intentional, but I found errors in my last practice. An employee left, kind of underwhelming employee, short term, transitional step type thing. And I just suspected something wasn't quite as up to par as it should be. So I had non-front desk person go back and compare the schedule, look at the schedule, and then look at the patient on the schedule and look to see if what was on their balance sheet matched, and insurance was submitted to match. We found $30,000 of non-submitted insurance claims for a 6-month stretch.
Wow.
We got all of it because we submitted it because it was under the 6-month mark. How often had that been happening? I don't know. So, and that was with cross-trained staff and me being in tune to the numbers, and it still slipped through. But my gut told me something wasn't right. So cross-training, spot checking, run your own reports, and really keep close eye on what's going on. You don't have to look at it, run a big audit all the time, but at least pay attention, and I also had my front desk person print reports instead of just looking at it on the computer. I had them print the reports and bring them to me, hand them to me directly on a set interval, so that there was some level of accountability of, I have to hand you this report. I ran the report. I have to hand it to you. So they knew I was monitoring. And once I implemented those things, I got paid for what I was doing, which was nice. So, things like that.
If you think that $30,000 mistake or a group of mistakes totaling $30,000 that happen every year over a course of 10, 12, 14 years, it's a lot of money. I mean, we're talking rule of 7, you've 7 figures in a practice's lifetime at least, or more.
that's arguably your basic retirement fund.
Yeah. Yeah.
If you have 60,000, if you saved $30,000 a year for 25 years, you're retired.
Right. Yeah.
So, it's just so you implement these systems, get familiar with the system. I was speaking with one of the main banks that does lending, on the same topic of a doctor, overlooking things. Bought a practice, they were struggling. The banker stepped in and said, "Hey, we need to work on these numbers. What's going on? Let's dig into this. We're running some risk here of default, et cetera, et cetera." And come to find out, one of the problems, and this just still bugs me and surprises me. And I heard this 5 days ago. The doctor, when they bought the office, in going in and checking out the office, didn't look at one chart, nothing. Right. No charts, no x-rays, nothing. Just looked at the reports and was like, "Oh, how wonderful this looks." But they didn't know what type of dentistry was being done. And you need to know that. I know of a doctor who bought an office that was way underperforming, lots of untreated patients or undertreated, and went in and just blew it out of the water and took a $600,000 practice, turned it into $1.5 million in 1 year.
Right.
That same doctor, this is a very important thing. That same doctor decided to do it again. Total failure. Lost hundreds of thousands of dollars on this office. And I think it comes down to, it's kind of a culture thing. The patients were accustomed to the work they were getting and the mode it was in. And so they were happy there, and you came in and tried to overhaul it and it didn't work. So that person that blew it out of the water also lost hundreds of thousands of dollars on the second time they did it. So it's a risky venture. Potential looks nice when you're looking at these things, but you got to understand that if you've got a lot of patients that are used to patch up dentistry, that could be tough to convert them into standard of care work. So a word of caution with that. Round down on all your numbers on where you think it'll be.
Right. Yeah. I mean, I think it kind of goes to show you that, numbers don't lie, but they never tell the whole story either. Right. Got to look at both. Right. 100%. Let me ask you this. Who's kind of an idea fit? Who's to work with you? Who's an ideal candidate? Someone who, might really benefit from working with you. I know that we don't all work well with everyone, of course, right? There's some people that are certainly not a good fit for you, but who is a good fit?
Right. I like people that you can just have what feels like a genuine, regular, neighborly type conversation, instead of the person that talks about how amazing they are. Sure. So I like just a regular, well-grounded person. I guess that's that Midwest component in me showing through. Born and raised in the Midwest, and I guess some of that. But in terms of where they are in their career, it's the dentist that is about to buy or buying or just bought a practice. More likely the solo practitioner. They need another doctor's eyes and ears to bounce things off of and to look. And going back to my proofreading example, someone to proofread what's going on in the practice as a whole. Right. I can also come in and speak with the staff confidentially and get a pulse of what their feelings are in that transition. They're going to tell you everything's amazing and wonderful and so on and so forth, because they don't know what else to say. Right. So, I can be that person that helps relay the information in terms of general topics, so you don't single someone out. So then you can build some more confidence and have the staff feel that they are being listened to and are not afraid to say something. And even still, they're gonna be a little bit guarded. I don't think that's a fault. I think it's just normal human nature.
Right. Yeah, it makes sense to me. Website one more time is jeffreyscheperle.com. We're going to post the link, of course, on our blog and on our site and on our social media. Dr. Scheperle, thanks for coming on again, sharing with our audience. Really appreciate it.
Of course. It's good to be back. I'll be back again.